Welcome, everyone, to the HSC Office for Diversity, Equity, and Inclusion Native American Heritage Month event. I'm Dr. JP Sanchez, and I serve as the Executive Associate Vice President in the HSC Office for DEI. On behalf of all of us in the office and Vice President Dr. Gay, we would thank you for making time to join us. For those who are unable to join us today, or if you would like to check back on this video recording, this presentation will be posted on our website. Before we begin, I just want to go over a few housekeeping items. We will be using a Zoom webinar format that does not allow participants to address the panelists directly. However, please use the Q&A function to put questions, thoughts, and comments, and our distinguished speakers will be able to respond to you. Secondly, we're going to put in the chat box a pre-assessment survey. I ask that you take a moment and complete this pre-assessment survey. It's really helpful. Alec and Haley are working to submit this as a module for publication consideration in MEDIC Portal. We've been working with them over the past couple of months. So your anonymous information in the pre-assessment and post-assessment survey will be of huge benefit for them. So without further ado, please help me in welcoming Alec and Haley, and they'll be taking a moment to introduce themselves in the workshop.
Great, thank you so much, Dr. Sanchez. Miyu Yam, on the Tong Alakalakika, on the Taf Tamangai. Good afternoon, everyone, from wherever you're joining us. It's my pleasure to be joined with Haley Baker. Haley is a medical student at the University of Minnesota and a citizen of the Cherokee Nation. My tribal affiliation is with the Palma Band of Luiseño Indians in North County, San Diego. And we are extremely excited to share our module and the work that we've done on a topic that is very important when considering clinical care for American Indian and Alaska Native patients. We are so grateful to have the support of not just Dr. Sanchez, but also of the greater BINGAP, or Building the Next Generation of Academic Physicians community, as well as the National Board of Medical Examiners for sponsoring our academic medicine writing fellowship. Over the next about 45 minutes, we hope to demonstrate to you the importance of traditional healing practices in Indigenous communities, dive a little bit into the literature that supports coordination of care between traditional healers and physician-led healthcare teams, and then finally end by showing successful examples of traditional healing that's currently used in Indian Health Service, tribal, and urban Indian health programs in the US. We'll start off by thinking a little bit about common terminology, some kind of level setting, and sharing a little bit about the health status of the American Indian and Alaska Native population, move into kind of the structure of the Indian Health Service, and then close with a special focus on traditional healing and some considerations for policymakers, advocates, but especially you as kind of trainees and healthcare professionals across the med-ed continuum. So in thinking about language, language matters. It also evolves over time. As Indigenous peoples, we historically have our kind of own way of identifying ourselves. So for my tribal affiliation being the Palma Band of Luiseño Indians, it's technically more accurate to say that I am Palmangai, or from Palma, or Payom Kawicham, a person of the West. The terms that we use to identify ourselves now were given to us by the federal government, and we have a kind of special relationship with the United States that provisions healthcare, education, and other social services. However, Indigenous peoples are not just indigenous to where they live now due to centuries of settler colonialism, forced displacement, and other conflicts. So there are estimated to be around 370 million Indigenous peoples across the world, more than 70 countries. It's around 6% of the global population, but unfortunately, this group is 15% of those who experience extreme poverty. When considering Indigenous peoples in this presentation, we'll be focusing mainly on American Indian and Alaska Native peoples, not necessarily Native Hawaiians and other Pacific Islanders, who are also Indigenous peoples who maintain their kind of political sovereignty today, but do not have the same status that they do with the United States. And then as of today, there are hundreds of federally recognized American Indian tribal governments. There are more that are seeking recognition or are not recognized by the United States. And there are no entities that are Native Hawaiian or Pacific Islander. When considering the kind of dual status of race, ethnicity, with the kind of political nature of being Indigenous in the US, we like to draw from one of 5 racial identifiers that the United States Census Bureau maintains. One of those is for American Indian and Alaska Native peoples. And these are defined as people having origins in any of the original peoples of North, South America, and Central America who maintain tribal affiliation or community attachment. This is very different than other racial identifiers in that there's kind of an active kind of component that maintains that it's not just how you identify, it's also how you function in society within a community. So you have to maintain actively a community attachment or tribal affiliation. And you can't just simply kind of check a box and that would satisfy your kind of identity as American Indian and Alaska Native. But of course, this is very complex, and there's certainly a kind of checkered past when it comes to identity and what it means to be Indigenous. But of course, that varies from community to community. Next slide, please. So I'm thinking of the kind of heterogeneity of our cultures. It's important to state that Indigenous peoples in the US and beyond are not a monolith. We each maintain our own distinct pre-colonial languages, traditions, and cultures. And if you're familiar with one tribe, you're only familiar with one tribe. You can't necessarily generalize their practices or their traditions from community to community. It's important to make that distinction and not just kind of group everyone into, kind of one bucket, if you will. Of course, where we are today is really kind of at the point of 500 years of contact, cultural genocide, assimilation by European settlers, by the United States, who once sought to assimilate Indigenous peoples into American society. This was done through things like state and federal laws, policies, and judicial rulings that kind of placed us as second or inferior to the general population. But there's really a turning point around 50 years ago with passage of the Indian Self-Determination and Educational Assistance Act, which ended this period known as termination. And we're now in a period where the federal government has recognized that there is a need to promote health and wellness among Indigenous peoples. And shortly after this law was passed, there was also passage of the American Indian Religious Freedom Act, which legalized open cultural expression of Indigenous identity and increased access to our historical practices, as well as the lands that we conduct our ceremonies on. Next slide, please. When we consider the past, it's important not to stay in the past, but to really acknowledge the hardships that our communities faced and use it to understand where we are today and understanding present day disparities ranging from alcohol and substance use, self-harm, as well as other behavioral health disparities among American Indian youth and adolescents. Pictured here is the Hiawatha Indian Insane Asylum. It operated from 1898 to 1934. And this insane asylum, pardon the terminology of the time, was not a place for healing. It was actually a place for harm or kind of misguided help. There, according to UC Berkeley, inmates were imprisoned for reasons that had nothing to do with mental illness. Some were there because they had epilepsy or physical deformity from an injury. Others were there because they had a disagreement with a schoolmate or a spouse, or, and very importantly, they refused to give up their way of life. Many were under the age of 30, several were children, and for some of these groups, by labeling them as disabled or less than, the government justified that they should not be allowed to pass their genes to the next generation. We also saw a number of elders that were kept at this facility just because they refused to give up their culture, their language, and their historical ways of knowing. Next slide, please. So in really thinking about where we're kind of conceptualizing health or how we're kind of presenting it to you today, we present this question of what does it mean to be healthy, or what does it mean to be well for the Indigenous patient? When we kind of think of modern medical practice, and I kind of really think of us really kind of staying in the physical domain of health, being um, lab values are optimal, they're within range, there's no kind of obvious abnormality or kind of ailment. But for American Indian and Alaska Native healing practices, or for traditional healing, it's much more than a physical domain of health. It's also ones of spiritual, mental, social, emotional, but also appreciating the interplay between each of these domains and thinking about how we can't prioritize one domain over the other. We really have to be taking a more holistic picture of health and understanding that traditional healing from an American Indian and Alaska Native sense is much more about being in relationship with community, as well as being kind of whole to yourself. Next slide, please. So this is a very complicated framework, but it's one that just kind of impresses upon you that health is complicated, and what determines health for Indigenous peoples is very complicated. This is a framework from the National Institute of Minority Health and Health Disparities, adapted to reflect the historic and sociocultural influences for Indigenous nations. So across 5 different domains of influence, ranging from the biological to the systems level, and for levels of influence ranging from the individual to societal, we can kind of think about how health is not just about kind of innate human behavior, about genetics, about biology, but also the environments and that systems that Indigenous patients have to interact with each and every day. This presentation, of course, focuses more on the kind of bottom right side of this figure as we kind of think about the patient-clinician relationship, implicit bias, cultural construction of health, as well as the quality of care that our patients receive, as well as reimbursement and kind of funding methodologies for tribal healing ceremonies, and how laws today do not make that payment possible. Next slide, please.
For this presentation, we would love if it was as interactive as possible. And we have multiple of these questions to kind of get you thinking about what's to come. If you feel comfortable, please put your own answers into the chat so that we can go over them before we answer the question. But we will start today off with what is traditional healing? Rooted in cultural traditions and healing practices that predate imposed healing practices from outside the original culture. Love it. We'll give a couple more minutes for any other thoughts. Healing based on beliefs which may be separate or mesh both Western and Indigenous cultures. Awesome. Thank you.
Wonderful. Thank you so much, Colleen, Melody, and Leanne. You all really have connected on kind of what traditional healing is. It's, since time immemorial, we've had ways of promoting health and wellness amongst ourselves as well as within our community. And it's not just rooted in cultural tradition, it's rooted in knowledge as well. Thousands of years of direct observation and understanding the medicinal properties of certain plants, but also the power of other things like song and prayer, storytelling, and really promoting healthy relationships across generations. The World Health Organization has recently taken an outsized focus on the rights of Indigenous peoples and understanding what traditional healing is across the world. And their definition here is the sum total of the knowledge, skill, and practices based on the theories, beliefs, and experiences indigenous to different cultures, whether explicable or not, used in the maintenance of health as well as in the prevention, diagnosis, improvement, or treatment of physical and mental illness. And really, the goal of our presentation today is to kind of understand how we can best coordinate between these two systems of healing in order to promote Indigenous health equity today. Next slide, please. Some common misconceptions with traditional healing practices, especially among American Indian and Alaska Native communities, is that practices like burning sage or sharing tobacco, among other practices that are specific from community to community, is that these services may be conflated with naturopathy and naturopathic medicine as popularized in the media. We're not advertising practices that have been kind of popularized by celebrities. These often kind of warp the kind of importance of these practices, especially from kind of an outside looking in perspective. Secondly, that there's no quote unquote evidence that these practices are effective. When using kind of Western ways of evaluation, such as statistical significance or experimental design, such as a randomized controlled trial, that's not kind of a proper way of, that's when thinking of kind of how Indigenous communities generate knowledge from experience, you can't use one way of knowing to validate or invalidate the other, but you also kind of have to think about, hearing what people tell you, but also understanding that there's no evidence that these practices harm communities. So just something to keep in mind there. And the relationships between Indigenous communities and traditional healers has not always been a positive one. And looking at the American Medical Association Strategic Plan for Health Equity, they published in AMA Transactions requirements to practice medicine in I believe a northeastern state. And it's quoted as saying that in 1849, one of the state medical societies called for all quote unquote irregular bred pretenders like Indian doctors to be considered illegal practitioners. So, kind of thinking about how our ways of healing have been viewed historically, it's not always been in a very positive light. Next slide, please. So, and moving to the second question, can you think of other non-Western services or practices that are already provided in healthcare systems for patients from other racial and ethnic groups? And we'll give you a few minutes to kind of type out any answers that come to mind. right, Dr. Sanchez with curanderos, Justin here, dry needling or acupuncture. Um, I can think of other examples such as Reiki with energy healing, and also kind of, not necessarily non-Western, but more, rooted in spirituality, is thinking of the Veterans Health Administration offering coverage for chaplain services for their patients. So, in thinking about, why healthcare systems do this, it's because they acknowledge that there are certain practices or services that patients see as important to their health. And it's really important that these services, whatever they may be, are coordinated within the auspices of their kind of treatment plan, and making sure that we maximize patient satisfaction and access to care, but also respect their health beliefs and attitudes. Next slide, please. So, in thinking of, the kind of, evidence or kind of where the federal government is on traditional healing practices, we often look towards the direction of the U.S. Substance Abuse and Mental Health Services Administration, or SAMHSA, which has recognized the body of literature stating that cultural identity or cultural connectedness as American Indian or Alaska Native, specific to each tribal affiliation, is a behavioral health protective factor among American Indian individuals and communities. And specifically, this connectedness has improved health intervention outcomes in the context of medication-assisted therapy for opioid use disorder, as well as American Indian youth mental health. So we see traditional healing be a core component of substance detoxification, as well as continued abstinence from alcohol and substance use for American Indian youth who are seen at government-run youth residential treatment centers, as well as other facilities that, again, coordinate care between kind of indigenous principles as well as a modern medical practice. Next slide, please.
For our next question, we would like for you all to think about and put in the chat, if you're comfortable, why traditional healing is important for American Indian and Alaska Native patients. These are amazing answers. Providing patient-centered care, culture is health, reasons having to do with connection and identity, lack of trust towards Western medicine, and being a part of cultural and personal identities.
Yeah, I love all of these responses as well. Haley is, you know, correctly observed that, you all have such great insights into this topic. And, it's, I think hard for me to grapple with is what Bianca has posted, which is the lack of trust towards Western medicine and the actions that, institutions have done to, lose that trust. And that, medical distrust is very, very real within our communities, but Indigenous peoples are not, anti-science or anti-medical care. What it really is that we're anti-exploitation. So by really, again, seeing the importance of, culture and identity and understanding the needs of the patient, we can really make sure that they get the care that they need at the right time. Next slide, please. So now we're going to move a little bit into the Indian Health Service. This is a bit of a quicker section, so bear with us and put your seatbelts on. The question that we're kind of just starting off with, and luckily I have not revealed the answer yet, why do American Indian and Alaska Native persons or tribal members have a right to health care? There are very long answers, but there's also just kind of a one-word answer, and we'll see if someone gets it. Human right, equity, treaty rights, treaties. Perfect. So Article 2 of the US Constitution, treaties are the supreme law of the land. And working within the framework of the Constitution, as well as judicial rulings, executive orders, among other factors, all of these kind of laws and regulations have created a system where the government has assumed a quote unquote trust responsibility to provide not just healthcare, but also physicians to care for American Indian and Alaska Native persons. So it's not just a kind of moral obligation to care for Native Americans because of the loss of life, land, and culture, but also because they signed treaties giving away their land and resources in return for these responsibilities by the US. Next slide, please. So the Indian Health Service has a very interesting timeline. It is currently a agency within the Public Health Service, managed by the Department of Health and Human Services. However, it's currently funded by the Department of the Interior, which is responsible for the country's land and mineral rights, as well as American Indian and Alaska Native persons. But in its very beginnings, it was actually housed within the Department of War. So the Indian Health Service was an agency tasked with curbing the spread of disease from the indigenous population to non-indigenous peoples. So reservations were used to essentially contain the quote unquote Indian problem and make sure that the general population was free of diseases and other conditions that were more prevalent in indigenous communities. And only until the 1950s did that shift to an obligation to actually address the high rates of disease and injury within this population and work to curb health disparities. Next slide, please. So the mission of the IHS today is to not just raise the physical health of Native peoples, but also their mental, social, and spiritual health, and ensure that comprehensive, culturally appropriate healthcare services are available. But unfortunately, this promise of safe, equitable healthcare for IHS patients remains elusive, largely due to underfunding of this key federal agency. But it's one where advocates are strongly working to ensure that services are available when required by patients. Next slide, please. Today, the IHS is divided into 12 service areas: Nashville, Oklahoma City, Albuquerque. You'll notice that they can include, one state, multi-states. The Navajo Nation has their own service area due to a treaty that they have with the federal government. But overall, the user population from area to area is comparable. The only kind of major difference is that on the West Coast and Pacific Northwest, you'll typically see healthcare facilities managed by tribal governments. But in the Midwest and kind of more central regions of the country, you'll see a greater prevalence of facilities that are run by the federal government and not by tribes themselves. Next slide, please. So today we have 3 systems of care within the kind of umbrella of IHS. We have federally run facilities, tribally run facilities, and FQHC lookalikes that are urban Indian health organizations. These urban organizations care for urban Native Americans as well as low-income Americans that are able to access these facilities. Tribal health facilities are either run with tribes or tribes assume control from IHS facilities. But overall, this network cares for around 3 million people, and more than half of IHS facilities today are tribally run, not federally run. Next slide, please. So I mentioned that we're in this period of self-governance and self-determination, and only in the last 50 years. It's not that long in kind of span of things. And what self-governance means is that tribal leaders and members are in the best position to understand the healthcare needs and priorities of their communities. And the reason why IHS facilities are increasingly tribally run is it allows communities to best prioritize how they wish to design healthcare programs, how best to structure their clinics, as well as really how to incorporate culture and traditions into the care that their patients receive. Next slide, please. So now this brings us into the third and final section, which is about traditional healing services. So in thinking, kind of where we are in the kind of grand scheme of things, I'll start with a statement from the Minnesota Department of Human Services. And they state that research consistently points to the value of traditional healing practices designed and delivered by American Indians for American Indians. And when we look at things, traditional healing for Native peoples have outcomes equivalent to conventional interventions in other populations. So when we see evidence-based interventions that are designed for substance use or other conditions, you bring that to a Native community, and it doesn't always work out because the evidence for those interventions wasn't generated with American Indian and Alaska Native communities. But when you actually start to integrate culture, American Indian, Alaska Native values, and those kind of worldviews, you start to actually see those interventions become more effective because it takes into account local context. And again, it's really inappropriate to evaluate Indigenous healing practices and knowledge with a Western lens. And this was really affirmed in November of 2022 with the White House Office of Science, Technology, and Policy releasing government-wide guidance stating that Indigenous knowledge is equivalent and parallel to Western methods of inquiry, and that federal agencies should really consider ways of allowing tribes to determine what it means for an intervention to be effective within their own context. And we've also seen Medicaid managed care plans in Washington State, New Mexico, California, and Colorado, as well as Arizona, if I didn't say that already, consider or even start offering traditional healing as a covered benefit for reimbursement for their patients. Next slide, please.
What are some of the barriers that you can think of that would impact accessing traditional healing for American Indian and Alaska Native patients? We have hospital and clinic regulations, insurance, lack of American Indian and Alaska Native doctors, nurses who can deliver traditional healing practices, excluded from the medical school curricula.
Yeah, I think Scott, you bring a very kind of active perspective on the matter, kind of, not just non-inclusion, but exclusion. And today we see only 11% of medical schools have American Indian and Alaska Native health content in their curricula. So when we're training physicians, they don't, necessarily get exposed to kind of American Indian and Alaska Native worldviews on, what it means to be healthy, but also again this cultural construction of health, as mentioned by that research framework. Other again things, hospital and clinic regulations, who's allowed in our healthcare facilities, who can see patients, is it a accreditation issue, is it a certification problem, also insurance. Many IHS facilities today, can offer traditional healing, but it's often goes uncompensated. And when we think about, again, how important culture is to promoting health for IHS patients, it's really something that we kind of have to kind of question and wonder, why are things the way that they are? Next slide, please. So some barriers, to name a few, is that while the government has a kind of supportive stance towards traditional healing, it's in the mission of the Indian Health Service itself. The kind of cornerstone legislation for IHS, the Indian Healthcare Improvement Act, does not authorize government payment for traditional healing services, which is unfortunate already. But when we consider that the IHS is so underfunded, one would think, oh, perhaps we should amend this law and say that the government can pay for it. However, resources are already so thin to where we're not looking towards IHS for potentially expanding access to traditional care, but really thinking of the patient populations that would most benefit from these services and thinking about how that population is more likely to be enrolled in other public programs, such as Medicaid, for example. So we've, again, seen that some states are pursuing authority from the government to reimburse for traditional healing services. And this is very much an ongoing process where they're trying to figure out, how do we, what's the payment rate? How do we code for it? How do we document it? How would we essentially kind of, quote unquote, regulate this process? And it's something that's kind of an active kind of back and forth between tribal leaders, healthcare systems, as well as state and federal officials. But I will say for the previous slide, what's important about these waivers, and you'll see this in the Arizona documents, is that they require coordination of care between physicians and traditional healers. And it's only at IHS, tribal, and urban facilities. So these waivers aren't seeking to kind of open the floodgates to access traditional healing, but really prioritize it towards these specific systems. In that these waivers would define what services are approved, what services are medically contraindicated, who's certified to provide healing, and how does this kind of service kind of fit into a larger care plan for a patient. Next slide, please. So some successful cases that we've seen include the Traditional Healing Clinic at the South Central Foundation in Alaska, currently where Haley is right now. This clinic requires a referral from a patient's PCP or from other medical specialties, and they offer services such as physical treatments, counseling sessions, and cultural classes to foster connection to Alaska Native cultures. And a 2016 satisfaction survey found that around 90% of patients or customer owners in that healthcare system stated that services were either extremely important or an important aspect of their healthcare. Next slide. Another example is the Winslow Indian Healthcare Center Navajo Traditional Medicine Program. This is at a government-run, not a tribally-run IHS facility. These services were started at the facility in 2019. And notably, it offers a specific apprenticeship and certification pathway with recognized Navajo cultural leaders, respectively, medicine man or women, but also the specific terms for, those kind of occupations in the Navajo language. And, again, this is a great example of how can a healthcare system work with community, tribal leaders, and cultural knowledge holders to ensure that these services are available for the patients who could benefit from them the most. Next slide. So some considerations as we kind of start to wrap up today and move into the final discussion is that according to a scoping review from Nicole Rudvers and Blondin in 2020, is that Indigenous patients may value input from their traditional healer more than their primary care provider and receive traditional healing without informing their physician-led healthcare team. which isn't, a bad thing, but it is reflective of, decades or centuries of medical mistrust, and really, again, fears of, bias, stereotyping, discrimination, and not wanting to reveal that aspect of someone's kind of health beliefs to, modern medical practice. But it's worth again saying that, indigenous worldviews on health and wellness can't be discounted or ignored when considering, optimal care for Native patients. So the kind of message here about, integration of care, coordination of care, is that it's all about shared decision making and ensuring that there's a strong patient physician relationship, and that, a physician is able to identify a patient's cultural and their spiritual values and how they interface with their health attitudes and beliefs, no matter their background. This is true for, indigenous patients, American Indian, Alaska Native patients, but also those from other, racial and ethnic minoritized groups. It's not, about, cultural competency or cultural proficiency, but really about just cultural humility and listening with an open mind, and making sure that, you acknowledge and value what's not necessarily important to you, but what's important to the person or group in front of you. So it's important to, again, affirm these worldviews, because it may, otherwise may lead to stigma and discrimination. Next slide, please. So, in wanting to really understand all perspectives, positive and negative, do you have any, concerns with, bringing traditional healing into, a healthcare system or into medical care? But also just, where do you see, where you kind of see this like in practice? Is the traditional healer, someone who would work in a healthcare system? Who would, who would they best interface with? And if you'd like, you can also, outside of your comments, you can also submit formal questions into the Q&A as well. Great, Dr. Sanchez, interface with the entire team, but with the patient at the center. Very nice. A great question, Leanne. What's the best method to introduce a traditional healer to a patient? Not all American Indian patients practice traditional healing. That's certainly the case. I myself, did not, readily kind of have the option of receiving traditional healing practices at my tribal clinic. That's not to say that I wouldn't be interested in them, but growing up, it wasn't as central to me, kind of growing up kind of away from my community. But what I will say is that it's not about, it's making services available or having the door open, especially if a patient requests or kind of, sees these services as particularly important to them, because each person has a different relationship with their native identity or their indigeneity. And, everyone's experiences are valid. And it's, again, it's not just kind of a, um, result of, personal beliefs. It's also kind of what it means to be Indigenous in the year 2023, when our communities have gone through, forced removal, assimilation, experiences in trauma at boarding and residential schools. And that's, a lot to really unpack, and why traditional healing is not, solely, we're not primarily on, physical intervention, but really on kind of psychosocial wellness and kind of revitalizing the importance or kind of centrality of culture as health. I also see this question from Natasha. Hopefully, people can see it now, which is, how can we get insurance companies to pay for traditional healing services? Of course, we've been thinking about, public payers, the federal government, because the government has an obligation to do this. But there are American Indian patients that are covered by private payers, and it's always hard to kind of demonstrate the need for something when you may be a small user in a population. It's like, well, why care for the 1% when we can focus on the 99%? And when you're kind of almost invisible within healthcare systems, it's hard for your priorities to be seen. So that's why, grassroots advocacy is so important, getting in the media, but also just kind of putting a spotlight on, cultural connectedness and what it means to be connected with culture, is incredibly powerful for youth and adolescents. So, I think it's going to be a process, and trying to get in front of the right people, but it's certainly not impossible. Dr. Sanchez has also put the post assessment in the chat. But it takes just a minute. So please, highly encourage you to fill out the post assessment before you sign off for the lunch hour. Haley and I, learned so much from all of you, and getting everyone's perspectives. We get different perspectives every time. But I think what always impresses me, and I'll let Haley share as well, is just how open and eager everyone is to learn about these services and what it means to kind of incorporate culture into medical practice. That's why we're on the journey that we are as future Native physicians. And Haley, please share your insights as well.
Absolutely. It means so much for every presentation, all of the questions and the willingness to learn. It's so important for us to know that people in the future are going to take care of our relatives well.
Beautiful. And thanks for sharing, Carla, as well in the chat.
Additionally, we have this practice scenario for people in the future, just to think about your own explanations and to bring all of this information together for the future.
right, thank you again. And I believe, oh, yeah, there's our thank you slide. Please do not hesitate to reach out if you have any questions. Again, thank you to our organizational sponsors, who've really kind of, made all this possible in the last, like, I think about like 5-6 months. Certainly been a lot of learning, a lot of reflection. Carla, it's, so important to understand, that you can have both and that, it's not about one over the other, but understanding that, when you work at the intersection of both systems of healing, you can really reach a higher level than what we thought was possible.
Thank you so much, Alec
Thank
and Haley. I just want to pose another question, 2 questions, as our participants are thinking of additional questions and comments. Can you share a little bit about your relationship with ANAMS and AIP and how those have served as 2 forums to provide education and training on not only traditional healing, but other topics in ensuring health equity?
Sure. The Association of Native American Medical Students and the Association of American Indian Physicians, both started in the 1970s as kind of places to foster, community and connectedness among, Native American medical students and physicians, as well as those in the allied health professions. But they're not just organizations open exclusively to Indigenous peoples. They're also open to allies and advocates and those wanting to, learn more because they're passionate about minority health, or they, grew up in an area with a high Indigenous population. And these are areas for, where you can be very, humble or demonstrate cultural humility and, just kind of listen and learn. I think Indigenous worldviews are so kind of marginalized in society, but when you go to a space that intentionally centers them, you get an entirely different perspective on, kind of how society views Native people, but also how we can have solutions to many problems that we face today, ranging from healthcare systems to wildlife management, cultural burning for fire, or stewardship of forests. There's so many different disciplines, but this one is on healthcare, but we can have this really across the entire spectrum.
And any additional thoughts on in terms of your own training? And you sort of touched upon this, but you yourself, how the both of you have developed knowledge around traditional healing. Any additional recommendations for learners like yourself, medical students, residents, and fellows, but then separately for all health practitioners, right? Whether it's physical therapists or social workers, any additional recommendations on how to continue their learning?
Just speaking from personal experience, I'm enrolled in the Cherokee Nation, which is down in Oklahoma, but grew up in interior Alaska. So I was very far from my tribal community. And coming with that, my family and I are patients at the tribal health centers throughout Alaska. And as we saw with South Central Foundation, they have one of the most thriving traditional healing practices incorporated into their health system. So for myself, I've learned about traditional healing through Alaska Native people, including leaders at the Alaska Native Health Board who were guests of the Association of Native American Medical Students at the AMA conference last year. And so just learning from elders and people who are more connected is how I learned myself. And then also just taking the knowledge that every community is going to have different practices and different teachings. And so familiarizing myself with the communities that I'm near, for example, in medical school at the University of Minnesota, learning from Anishinaabe or Ojibwe elders has been a resource. But finding those who are close to you and listening.
Yeah, I think echo all of that. My grandfather was a community health worker at our local tribal health clinic. His son, or my father, has now been the medical director of that clinic for 2 decades now. And part of traditional healing for Southern California natives is the use of a sweat lodge. And we have one on site at our tribal health clinic. And you'll find my father participating with members of the community, his patients, because it's not about those kind of power structures or hierarchies, but understanding that we're a community of physicians, educators, artists, storytellers, and each role is important. And at the end of the day, we all come from the same tribe and same group of people. And it's important to kind of be in relationship with each other. And that's really what Indigenous healthcare is about. It's maintaining positive relationships between individuals and between communities. So thanks, Dr. Sanchez, for your questions. And thank you, everyone, for your time.
Well, with that, thank you so much, Alec and Haley. Once again, excellent presentation. Thank you for your leadership on so many different levels. I want to thank everyone for joining us for this event for Native American Heritage Month. Once again, it only takes 2 minutes to complete the post-assessment, so please support Alec and Haley on this journey of getting this material out there to a wider audience. Join us for our final session for Native American Heritage Month, where we'll honor and celebrate leaders within our community. So with that, we'll stay behind just a couple extra minutes, but we're closing this segment. Take care.